Right, breaking news coming in. Prime Minister Narendra Modi has tweeted on the COVID warriors. The Prime Minister has said the Epidemic Disease Amendment Ordinance 2020 manifests our commitment to protect each and every healthcare worker who is bravely fighting COVID-19 on the front line. It will ensure safety of our professionals. There can be no compromise on their safety. National Affairs Editor Rahul Srivastava joins us with more details on this. Rahul, this comes after multiple cases. This also comes when the IMA had decided that they are going to protest. The government responding firmly and sending out a message that absolutely zero tolerance if our health workers are attacked.
Yes, Ankit, it was getting untenable. The kind of attacks which are happening on the health workers, the doctors, even the policemen, Ankit, various social platforms full of the kind of angst people are displaying against policemen who are trying to enforce the containment. Now, it has reached a point in which in several areas in the country, state governments had to push workers, health workers and others under ESMA, Essential Services Maintenance Act, actually to tell them that they have to report on work. And why were they reluctant to report on work? Because people were attacking them, people were harassing them, and they were facing social stigma as far as their own places of stay are concerned. And that's a terrible state of affairs, because given the kind of the first phase of battle against corona war, as we are far from the second one, in that it is very important that the workforce stays on ground and their morale stays on high. And it is perhaps, Ankit, a reflection on the times we live in, that a 123-year-old British colonial law has to be invoked at a time like this in 2020 against Indians. That was a British colonial law at the time in Bombay, when there was a instance of epidemic of plague. At that time, I'll read out the law which says that protection order allowed protection to persons under the Act who were working under the Act. Means at that time, people were resisting it because they were fighting against the colonial rulers. There were penalties against those who were acting against this act. But in 2020, in self-rule, in democracy, attacks on health workers, the frontline workers who were trying to fight the epidemic, had reached a point that the government had very little option. And also remember, in this scenario, what is happening, that vehicles are being damaged. Every state has very limited number of ambulances and other
resources right now are very, very important. I mean, if resources, not only the doctors physically, but also the resources are attacked, the entire health system comes under extreme strain as well. Rahul Srivastava, thank you so much. The Prime Minister himself, in fact, going out now and tweeting about this. But what was the need? Because once again today, there is an example of why the government needed to, in fact, implement this law. This story, in fact, coming in from Aligarh, where the policemen have once again been attacked. Violent mob pelted stones at the police party, and they also injured a police person. And earlier, similar incidents, in fact, were reported from few other states. In Aligarh, where you can see this stone pelting and the police being injured, this happened after a vegetable market in Aligarh's Bhojpura area was in fact still going on, despite the very clear norms, in fact, and timelines and guidelines been put in place by the police. When the police intervened to enforce the lockdown, the people resulted in stone pelting. So you heard the Prime Minister, who in fact reacted on this, and why, in fact, on the day today also it's a reminder of why the government needs to be tough. The central government has come up with an ordinance, as the Prime Minister's tweet was informing us, to protect the healthcare workers. As per the ordinance, attack on healthcare workers will be considered a cognizable and non-bailable offence. Investigation in the cases would be completed within 30 days and trial within a year. Accused assaulters will face imprisonment from 3 months up to 5 years and penalty ranging from 50,000 rupees to 2 lakh rupees in case of grievous injury to the health worker. The ordinance lays down imprisonment from 6 months to 7 years and penalty from 1 lakh rupee to 5 lakh rupees.
The cabinet met under the chairmanship of Prime Minister Narendra Modi and approved promulgation of an ordinance to amend the Epidemic Diseases Act 1897 in the light of pandemic situation of COVID-19. And this actually protects the whole health fraternity, including doctors, nurses, paramedics, up to ASHA workers. Everybody get protected because what we have seen, when they are doing a yeoman's job, when they are doing the most crucial duty for the country, at some places they are being attacked. And some places their property is damaged. And at many places they are being looked upon as the carriers of the COVID-19. So be it harassment or be it criminal offense against them in form of violence, for this government, that's a zero tolerance area.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.